Wait,
So a
wait.
little bit.
The same person or is this mother and daughter picture?
No, no, that's the same person.
Good day, everyone. I'm Dr. Arkhe De Leon, the dental architect. We have a very special guest for today, which is Dr. Ivona Introduction. She is a president and founder of the Academy of Face Design, London, and former president of AAFE, which is American Academy of Facial Aesthetics, Hong Kong, China. Dr. Ivona has also spoken at many international conferences, published 2 books, and organized workshops and seminars to train medical professionals in the field of anti-aging and aesthetic medicine. She is actually a dentist who is actually training not just dentists but also medical professionals. Let me welcome again our very special guest, Dr. Ivona Introduction.
Thank you. I'm so happy to be with you guys. I'm blessed to come back to Asia. I just love to be with you in Philippines today.
So, Dr. Ivona, we're gonna talk about Botox. Starting to be popular, really popular, the Botox. People notice that it has the tox word, which is meaning toxin. So, can you elaborate on what Botox is?
Well, when I train my delegates, I always say, please forget about tox word, because our patients and our doctors don't like these premises into the wording. So I usually say it's the same to say botulinum toxin as botulinum protein, because the molecule of botulinum toxin is mostly made out of protein. So Botox, what we are going to use on our workshops, is surrounded with protein, and very small part just go into toxin. Well, it is a very famous medical device, and believe it or not, my first application of botulinum toxin was for dental purposes for temporomandibular disorder at my medical school 1996.
So you've been
A
practicing
long time ago.
it's a
So I
long
don't want to say my age, but it's long time ago. And at that time, we were using botulinum toxin for medical purposes, and we did not know the big value it has for anti-aging and aesthetics. So we used to use it for neurology. We were using it for urology, gynecology. As I said, me for temporomandibular disorder, for salivary glands, for drooling. So a lot of different applications. Still a very famous couple for Canada, ophthalmologists. So you see all different doctors around there with botulinum toxin and with fillers. So this is the couple of ophthalmologists who first time spotted by treating blepharospasm, so injecting botulinum toxin in this area of orbicularis, ocular muscle, there is some big improvement in aesthetics and in anti-aging. So that were first little tiny steps in the world of aesthetics.
and then it expanded to almost
And it expanded big scale. So nowadays we have Botox parties. Nowadays we enjoy Botox for aesthetics mostly, right? So all the medical field is involved in botulinum toxin. So everyone is using on a way botulinum toxin for its medical benefits. And we know in dentistry, we use it so much for gummy smiles, for protrusion of mandibula, because we have to knock down those muscles here. Then to lift up lip corners, to, for grinding, for masseter muscle, and so a lot of different applications.
Wow. So the technology is there since 1990s.
Yes,
So
you see how old technology and how survivable medical device. I think more than before 1990s. So 1992 was the first humble moment where we started to think maybe we could, at some point, which did not happen in 1998, use botulinum toxin for aesthetic purposes. But Botox is in medical field long time ago.
So more or less, it has so many years of research and improvement of the formulation. So more or less, it's really safe now today.
Super safe. You know what? I always say to all my dentists that it's much more safe than injecting anesthesia with lidocaine and adrenaline. Much more safe. So less complications, less problems. Of course, you need to be trained, like in everything, but it's very safe.
Still overdose, right? There's still overdose when it comes to
Could be, and then we are frozen. We can move the face when it's overdose.
No more muscle movement.
No muscle movement. But then at the end, if it's even an overdose, after 3 months it goes away. So nothing to be worried about or scared.
It will eventually be gone. So it's not permanent damage, more or less.
Exactly.
Yeah. So the toxin already is very small, in a small amount only.
Very small.
Unlike
It
before in
looks
the
the
80s,
toxin.
the toxin is it's just a different formulation, or it's just a small.
Toxin is a very, very small part of the overall molecule. Now we have Bocoture from Merz, the only botulinum toxin which has no protein. And this little toxin gets into the nerve ending and just temporarily blocks the acetylcholine transmission. So on that way, we don't have contraction of the muscle. We can always dose it. If you put more Botox, then it's less contraction. If you put less Botox, then muscle is still moving, but on more, let's say, sophisticated way. And because of that, we don't have those wrinkles in movement. Can you see mine? So those wrinkles in movement.
So you can it's not totally blocking the muscle movement.
It depends on
You
us,
can
you know.
control it. You can control it. Sometimes
We
I
can
still want to have
control
a
it.
facial expression like that, but I want to lessen my wrinkles. It's
Exactly.
possible because
Exactly.
what usually people know is when you place Botox, it's like you're having a straight face. You're smiling, but your eyes are plain.
Not moving. No,
Moving.
I think, you know what? I think this is a bad way of use. That's abusing of Botox,
That's
right?
over.
So with Botox, we want just to have a softer expression because muscles must move, right? So we don't want to kill all the movement, all the mimics, but we want to look beautiful. We want to look natural. And we can look like that only if we move our face, right? If we move the muscle, but
So
not on an excessive way.
So what happens on those kinds of Botox is over a wrong mix of toxin already or too much. Okay, so
I
that's
would say the injectors inject too much Botox.
too much.
I'm always, I was also head of complication. So I can say that I would say like 70% of all the complications come because of us not being well educated and not understanding really botulinum toxin and dermal fillers and not knowing anatomy. So we need to understand the muscles on the face. There is 48 muscles and they have to move. And if I press so much this part of the frontalis muscle, of course, my eyebrows are going to go sky high, right? Because the other part is compensating this part which is missing. So it's all about Botox. It's knowing of the anatomy, understanding aesthetics.
And
Because,
balance.
for example, eyebrows. So in Western world, we like to have it a bit higher. In Asia, people like to have it lower. So you need to know how to balance those muscles which are lifting the eyebrows and make the beautiful expression.
Yeah, so it's a perfect balance, and really you really need a good training for that. How about doctor? How about fillers? What they're talking about fillers?
Fillers are amazing medical device. So I'm also working in biotech industry, which means I develop all those beautiful fillers there. And at some point, the industry said, okay, we are aging. What is happening in the process of aging? We are using hyaluronic acid. We are losing collagen. So let's replace that. So on a very natural way with DNA technology, we developed fillers with hyaluronic acid. Very safe, again, injected in strategic points on the face, bring beautiful results, and they're dissolvable. So they're temporary under our skin.
So fillers are not really like silicone or synthetic materials. So it's just hyaluronic acid, a liquid
Just as
you inject. So that's what fillers are. Okay. So, Doc, how about the applications of Botox in dentistry? How can we apply Botox in the dental?
Botox and dentist. So you see this picture. Can you see this patient of mine? So that's a beautiful application and way how to apply botulinum toxin in the lower facial third. So this lady had myofascial pain and she had problems with teeth grinding. Okay, so she would wake up in the morning and she would feel very, very tired already from the morning with some kind of constant pain. And she was sent to neurologist and nobody really could help her with the medication. Problem was overaction of her masseter muscle. So you see her masseter muscle was quite big on the picture before. And as well, she had hypertrophy of parotid glands.
Yes.
In the picture before. So knocking down both of them with botulinum toxin, she got a beautiful beautiful face shape, but more important than the other was her pain was gone. So she was so happy, and she's again one of my happiest patients ever, because she thought already she's going to get insane with all these problems she was having in the morning, and it was constantly lasting. And the other thing on her pictures, if you notice well, you see her lip corners.
Yes, yes.
Before and after. So knocking down the depressor anguli oris muscle, she got lifted lip corners. So I think the result, I was curing her mostly medically because she had this big myofascial pain, but at the end, automatically aesthetics came as a result on the lower facial third.
Really? So it's like hitting two birds in one stone.
Exactly.
Yeah.
I love to say that as well, because you know, every time you are playing with muscles, if muscles are working too much, so if they are in hyperaction and hypertonicity, then you can visually see it on the face, like you get certain face dysmorphia. And so if you put a muscle in the correct action, I would not say that her masseters are not working here, but they are working well. And you see immediately it reflects on aesthetics. Two birds in one stone, two hits, and we get one application and we solved her medical issue, which she was very happy to. But of course, she was super happy also with her aesthetics afterwards.
Because it's the priority is the pain. Okay, priority is
exactly. She came to me because of the pain. Yeah. So pain is something, myofascial pain, temporomandibular disorder. If you remember from the beginning, when I told you from 1997, I was somehow in the field of temporomandibular disorders. So I will show you a lot of beautiful cases connected to that. But you see, even treating those who are really serious problem for our patients, and this can't be in the hands of a dermatologist, can it? So this is our field. So we have to feel very comfortable with botulinum toxin, at least to treat medical problems in the lower facial third. And then automatically, if we treat them, aesthetics is coming secondary as a super bonus. Does it make sense?
Was the pain gone upon injection or?
Upon injection, after 3 to 4 days, this lady was super happy.
Yeah, she looks happy. You know?
Botox makes people happy.
Happy. And aesthetics was like a side effect only.
Yeah, can you believe how beautiful side effects you get from treatment of botulinum toxin?
Okay. Is there a maintenance on this kind of TMJ problem?
So maintenance is, you know, as we said before, botulinum toxin unfortunately is beautiful, but it lasts temporary. Same as dermal fillers. In the skin, we don't want, under the skin, we don't want to use anything which lasts long. All the things what you mentioned, what was let's say history of minimally invasive aesthetics like silicones, we want to avoid because there is some granulomatosis reactions, and you know, we don't want to have that under the skin.
We want it safe.
So we want Botox, and we want just to top it up. And the thing is, in dentistry, you know what I find out with us dentists? We are very prompt to find a permanent solutions, right? So all our bridges, veneers, they have to last up to 10 years. And here we just do something called management. So we have to explain to the patient, this is a chronic issue what you have, and you will be managed by us. So every 3 to 6 months, depends. Some people are dissolving Botox quicker, some people are dissolving Botox in a shorter period of time. These patients have to come back and they do the top-ups. Do you see the other case?
Yes, yes. This is the Gummy Smile.
This is the Gummy Smile. So do you know that I used to be periodontologist?
Oh, really?
So for me, yeah.
You studied so much field. You're all around.
Yeah, because I come out of dental family, and somehow it was natural for me to become a dentist, because these are the only issue we are talking in the family, you know, for all these big events before Christmas, before Easter, when we all gather, somehow coming out of dental background, you discuss teeth, you discuss everything. So there was never a question what to be in life. I knew very precisely that I'm going to be a dentist. But then I had the issue with Gummy Smiles. I was always obsessed about aesthetics. And, you know, it is hard to treat Gummy Smiles if you don't use botulinum toxin. And botulinum toxin, again, was a game changer for me, because putting like 5 units literally from one or the other side, you can treat Gummy Smile in a blink of an eye. It's truly amazing. No downtime. You know how hard is periodontal surgery, and then crowns after that. And it's hard for us, it's hard for patient, and there is never 100% precision. And here you can have whatever you want. You can dose it differently and you can play with the upper lip.
And it's non-invasive. So actually, I trained in what do you call this? Treating Gummy Smile, and it's very invasive. We have to cut the mucobuccal fold. We have to tie up the muscles in order to just to control the Gummy Smile. So this one is less invasive. And
Yes.
also during
And you know, I was sorry to interrupt. I
happen.
was doing a lot of surgeries to cutting those muscles, but then it's always about body healing, right? How the body is going to heal and how high this muscle is going to pull. This problem you don't have with Gummy Smiles treated by botulinum toxin because you are on a way master of the game there, and you are controlling how much the muscle is going to pull by adding less or more of botulinum toxin. So here is another example of the Gummy Smile.
This is same day, right? She has the same clothes. So
yeah, you see this patient of mine. She used to be my assistant in China. So she unfortunately was injected by permanent fillers in China long time ago, which means the silicone fillers. So her face totally lost the beautiful shape she used to have. So she was very conscious about her face. But what I did for her, it's Gummy Smile, correction of the Gummy Smile, and Masseter Reduction. So you see how better she looks after.
On Masseter Reduction, does it lessen in muscle here? Does it get smaller, or what will happen?
Yes, it gets smaller and the face gets slimmer in the lower facial third.
Okay. Yeah. When you look at the picture, in the first picture, you cannot see the ears too much, but in the second picture, you will
Yes,
see
you're smart.
So it means that it really got slimmer.
Yes, yeah, precisely so. Can you see this picture?
Yes, she has a different nose. What happened?
Different nose. But what is important for us as dentists is the lower facial third. You see how her mentalis muscle is strong and pulling back on a way mandibular. So probably did not allow her mandibular growth when she was a kid. And then I had to knock down with botulinum toxin mentalis muscle and reshape her chin. Of course, I did the nose as well, but more important for us as a dentist is the chin.
The chin was filled, it was applied with Botox and then filled with hyaluronic acid.
Exactly. And again, this is our field, dental field. It is a lower facial third. And who can do it better and who is more skillful in anatomy of the lower facial third and, you know, shaping and has this super precision in the eyes, super precision in the hands. No one than dentists.
Yeah, it's our expertise. It's really
exactly.
We've been looking for it for how many, every day of our lives, we've been looking at this area. So,
exactly. So this is again a beautiful thing, how to apply minimal invasive aesthetics into our dental work. For example, in orthodontics, you have to somehow finish or control some things what you can't 100% finish. You can do it always with minimal invasive aesthetics.
I can't believe that happened. That can happen a single day. That look.
This can happen in a blink of an eye. I don't know if you're very good trained, maybe in 10 minutes time. You have no downtime. Your patient is immediately happy. Yesterday, I posted on my Instagram testimonial of a girl who was really unhappy because she had this cleft chin, very tiny, beautiful, pretty face, and then this huge cleft chin. You know, when the mentalis muscle is not connected in the middle area, then you have this big chin dimple, and so she was feeling so insecure, so upset.
That's good for male, but not for female.
Exactly. That's great for male, but not good for female. Yeah. And she was super happy and she couldn't believe that if she read testimonials, she said, I couldn't believe that this magic on my face can happen in 5 minutes of time. And this is beauty of minimal invasive aesthetics.
To the audience, just imagine before when we're treating this kind of jaw, we have to open up the chin, we have to add bone here, and it costs hundreds of thousands pesos of surgery. But now look at this within a 10 minutes. I cannot believe this can be achieved within 10 minutes. So just imagine the old techniques where it's very, what they call this, very invasive.
Exactly. So nowadays our patients don't want invasive techniques and they don't have time to stay at home and be knocked down for 2-3 weeks time. I know how many of my patients who really need to go for surgery, they're planning surgery 2 years in advance because their life is so busy that you really don't have 2 weeks time to stay at home and do nothing, you know, and hide from the world. So what we want nowadays is quick, secure, effective technique.
And safe.
and yeah, and not so expensive like the other things are. So next one. So this patient again is a medical problem. So this woman was bitten by a dog, and as you see here, there is a tissue loss in the upper lip. So that's a very, very hard thing for the plastic surgery. Okay, because they have to regenerate the tissue. They had to. It's quite complicated one with plastic surgery, and never looks 100% beautiful. And you see what a nice achievement it is immediately after 1 ml of dermal filler. It's all the reconstruction, saving her from very, very difficult surgery, and never with a good promises of a good result. So this year I'm going for awards winning, and my other patient, because I became very famous for this kind of things, you know, when you have to reconstruct the face. My patient was bitten by a dog, and she had rolled in lips. So she did a surgery, and after surgery she had a complication that her upper lip rolled in totally. So what I had to do, I had to do sub-incision of the scar, because there was a big scarring there, and then I had to fill those lips with dermal filler, which was an amazing result. So we can really, really do great things with this minimally invasive medical devices in just a blink of an eye.
Yeah, sometimes because sometimes when you do surgery to treat scars, sometimes you end up a different scar.
Exactly. And you know, this is mucosa, and it's so hard when it scars really, because then part of scarring gets inside and pushes back the soft tissues, which is really bad. And you know, people are very conscious about lips.
Yes, so many things happening with just scar. But with with Botox and fillers, it doesn't happen. It's just a point. It's just a point invasive, you know. It's very
yes. You can use 90% of the time. You will see you can just use a numbing cream. Imagine that. We are again very lucky to be dentists there, because you know, for dermatologists, and even for plastic surgeons, can you believe that? I need to have a special course of infraorbital anesthesia, of dental block anesthesia, of anesthesia on mentalis muscle, on mentalis nerve. So, and we are blessed to know all that. So in the moment we have really a patient who is whose tolerance on pain is very low, immediately we take our another injection of lidocaine, and that's it. Again, in a blink of an eye, total anesthesia of the face, and you can work. So this is another blessing of dentists, and we are not aware that the other specialties have no idea how to do the blocks on the face.
Yes. Because we are already trained with the anesthesia of the whole lower third of the face.
Exactly. So now we have the other patient. Can you see this one?
The same day again without no need for bandage. I see some surgeries going out of the clinic with bandages because of the surgery and everything. But this one, no bandage, no cold compress, no hot compress. So
nothing. You have just to stop them to apply makeup immediately, because they feel so confident. Then they would run for their makeup. So no makeup after. They can make up after, let's say, 24 hours, and that's the only thing they can do. And you see, this is my Chinese patient here in London, and she had retrusion, mandibular retrusion, and so a tiny bit of, again, dermal filler, tiny bit of Botox on mentalis muscle, and her chin got protruded, and she has much better jawline.
Yeah, that's very common to us Asians with a very small jaw.
Okay, again.
I think let me guess, this Masseter Reduction on the side.
Exactly.
I can really see the slimming of the chin.
Yes, a Masseter Reduction and a little bit, tiny bit of chin reshaping.
Chin reshaping. So how do you do the chin reshaping?
With dermal filler.
Dermal fillers.
So it's like molding, you know. You have to watch on the face.
You add
like
heat,
a sculpture.
you can control where you just it will.
You know, when I was doing dentistry, then we used a lot of chin implants before, okay, for this kind of cases. And chin implants are never the best solution, because they come already in certain sizes and shapes. So you had to mold them, and it was again all complicated, and cut the mentalis muscle to position it. And now you can just inject dermal filler and mold it with your fingers, and that's it.
It will stay there for a while.
And it stays there. When we talk about high quality dermal fillers, they don't absorb water. So it means that after they're injected, they don't change the shape. So you mold them and that's it. They stay there. There is no migration, no problems.
So what happened if I apply pressure there for, let's say I slept on my chin? Will it do that, or what will happen?
No, we advise you not to sleep immediately on your chin. Let's say at least 24 hours to 48 hours, not to put your head, go for massage and then have the head kind of banded. But later on, it's totally okay.
It's gonna be
So when
stable.
it becomes, sorry?
It's gonna be stable eventually, meaning after
Yes,
48 hours, no matter what you do, it's gonna stay.
exactly. It's going to stay and it's going to be very, very stable. So here is another big, huge Gummy Smile. You see, especially in the lateral parts, it's Gummy Smile type 3. Again, repositioning of the upper lip. There are a lot of tiny little muscles like levator labis superioris alequenasi, levator labis superioris, muscles which need to be zygomaticus minor, knocked down with botulinum toxin and produce this kind of result. So all these cases are connected to the lower facial third and dentistry. Here you see aging Caucasian woman. So we age in a very, very bad way. So you see jowling, there is a big mandibular depression, probably osteoclast activity is much, much higher than osteoblast activities. And she needed to get, I think she got like 4 ml of dermal filler to get to this shape.
Wait,
so a little bit.
the same person, or is this mother and daughter picture?
No, that's the same person. But she's a very nice lady, Catherine. She's amazing. She sent me picture with her daughters. And then when you see her she has 3 daughters. When you see her with her daughters after injection, she really looks like one of them, It's funny that you were asking me this question. Well, maybe for Philippines, when I come there, I will find the picture for you. So you will see. She really looks like one of the daughters.
It really looks like a mother-daughter picture. It's like a totally different person. No, this is just Botox and fillers, nothing else.
Yes,
This
nothing else. Nothing else. So that's you see why I'm so in love with this aesthetic medicine and why I'm so passionate about it. The dentists have to do it because it's just it's in our these old patients are already there in our clinics and they just wait to be enhanced. And for me, it's a trauma. I tell you, it's a trauma when I have to train dermatologists how to knock down a Gummy Smile or how to treat bruxism. So this is something which belongs to us and we should never let these patients go from our clinics. Imagine to have this lady on your dental unit there and you are doing veneers for her. And then she's going out of your clinic somewhere else to do her treatment for the jawline and chin. This would be kind of weird, isn't it?
Because sometimes we design the teeth based on the lips, and if she's gonna change her lips, things will change also. So it's better if we plan the lips and we plan the teeth. So
now we can plan more. So we can't be limited only on the teeth, right? We have to go out there because beauty is, and smiles are skin deep. We have to enhance lips. We have to think about nasolabial folds. We can't be scared about that because sometimes I have this feeling that we dentists are limited into the oral cavity. And then when we have to come out there, we are a bit scared. It's a big space out there, right?
yes.
But it's much easier and much simpler to treat problems on the skin than in the oral cavity itself and less complications. So it's just our mindset. I think we have to come out there and understand that smile is part of the complex lower facial third and we are able to do it and to treat it.
And if ever the patient doesn't want the result, she just can wait it out, right? And it will be eventually...
If she doesn't want to dissolve the filler,
then
the fillers are again temporary lasting, and then and she can then wait to they will just be metabolized by our body. But usually, believe me, I never have a case when people look better aesthetically that they want to dissolve fillers. So that's a very, 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 very seldom, I guess. So watch this case. This is another thing because I was so much into temporomandibular disorders. This is Condillar Hyperplasia. This girl was not treated for that. And you see what this balance brought on her face. face before, and then you see her immediately after the treatment. So I had to balance all her right side and lift up her lip corners. And these little dots, what you see on her face, are after botulinum toxin. So first photography, I already put botulinum toxin onto her upper facial third. Because you know why? Because I truly believe that smile starts in the eyes. So you have to, again, as a dentist, if you are treating smiles, you have to treat area around the eyes as well, because smile starts there. So it's not the same how a big pool has orbicularis ocular muscle, because if it's hyperactive, then this smile is not going to look beautiful. So that's another thing why we have to, as dentists, think and consider again the upper facial third, or at least orbicularis ocular muscle, because smile starts in the eyes.
Yes, especially nowadays when we're always wearing face mask and we can smile with our eyes. So
Yeah,
it's
true.
very important for the smile.
Yeah, very important. Very, very important. So you see everything in the eyes, especially when you have facial mask. True. So condyllar hyperplasia, I have a lot of patients with that. You can reconstruct, at least try to balance, because the problem is in the condyle. One is one growth of condyle was stronger than the other. So all the face, in the case of this lady, turns into her left side, like a curve, curved into left. So you have to balance the soft tissues in the mid face, in the lower facial third, in her chin, in the lips, and try somehow to get it as symmetrical as possible. Of course, you can't, it's not surgery that you can get more, but believe me, surgery here on the condyles is just like mission impossible to make it right.
At least if ever she's considering having the surgery, at least temporarily she will look comfortable with her face, right?
Exactly.
If ever she wants a more invasive surgery, this will be a temporary fix or aesthetical.
Exactly. And she can see how she could look like. You know, sometimes people come before surgery and they want to just to see how they could look like one type of molding the face and giving them this 3D perception. Again?
Yeah, so just imagine, I just want to share that before, whenever I hear Botox, I only think about wrinkles. Okay, removing wrinkles, removing the line on the eyebrows. So I did not imagine that it would be this wider, this expanded, that even to the condyle level, we can actually use Botox.
Yeah, imagine how that's the beauty of it, because Botox works on muscles, right? And the main problem of temporomandibular disorders, I would not say the main, but let's say more than 60% of the patients comes out of muscle, same as migraine. A lot of them have muscle origin. So wherever muscles are involved, we can do a lot of beautiful things with Botox. Did you know that you can reshape calves on the legs with Botox?
Legs, really?
Yeah, you can make them slimmer, sexier. Ladies can wear high heels easy.
But will it make it weaker or?
No. Again, it's about dosing of botulinum toxin, and part of the muscle you are going to target. Then trapezius muscle for better posture, or also when you have migraines and triger migraines, then you involve trapezius muscles, sternocleidomastoideus. There's a lot of muscles on the neck and face. But this goes into our very advanced workshop, and that's why you can't really divide upper, middle, and the lower face, because all these muscles are overconnected, right? So for us dentists, the most important would be the lower facial third. But as we said before, smile starts in the eyes, and then you will not bring that patient to, I don't know, to dermatologist to treat orbicularis ocular muscle. You will do it because it's so easy, much more easy than treating the muscles on the lower facial third. So what do you think about this case?
There's a tip on the top, but
Dr. Kevin, what do you think about this lady? She's again a very sweet patient of mine.
She looks Filipino.
She is. She's American Filipino from LA, but she lives in London. Very, very sweet.
So I got it right. She's a Filipino.
Very sweet, very cute, very, very nice lady. And what do you think? What is her age?
I think, I'm not sure with the eyes, but I think around mid-30s.
She's 48.
48, really?
Yeah. She's 48, looks amazing. She's in a great shape.
Because
Yes,
if you
three
have a
daughters.
sharper chin, you have when you have a sharper chin and a sharper jaw,
Yeah.
that really makes you look younger.
And a little bit of medical device. All was done with not even 1.5 ml of dermal filler. And what is 1.5? I always say teaspoon has 5 ml. So it's, I would say, like 1/4 of a teaspoon. So which is not a lot, right? Of material of an implant. Let's talk about dermal filler like an implant. So
But
1.5 ml. This is really nothing.
but the
To
change you
reshape her
apply to the
nose, to
patient is
reshape her
very good.
chin. Yeah. But it's all about strategy, how you position those fillers. Watch this lady. That's another case for dentistry.
Look at that jawline.
Yeah. So she has progenia, and unfortunately, I couldn't find the picture where I started to treat her
I'm sorry,
because
what is
she
Progenia?
had a big reduction of fat pads in her maxillary area.
Mm.
So here on the first picture, I already treated her mid face, so she does not look so progenic anymore. But when I saw her, she had totally a fat depletion of the mid face, and more I was treating her, she was looking better and better. So her progenia was somehow disappearing. It's a camouflage technique, I call it, in front of her eyes. Yeah.
So Progenia is where you have a depression here.
No,
Or
progenia is a very strong jaw. It's
oh,
1% of our patients has this strong mandibula, which is in the big growth. So it's growing. So the lower teeth are positioned in front from the upper teeth.
okay, it's like a class 3 patient.
Class 3, exactly. That's progenia, class 3. But then progenia always goes with depletion of the fat pad, the strong one, 1% one, goes in the depletion of the fat pads in maxillary area. So there is no fat in maxillary area. Then this progenia looks even more underlined, or, you know.
So to catch up with the lower jaw, you
Yeah.
up the maxilla. Okay, so get
So
it.
again, who can treat it better than a dentist, right?
So that is a wonderful topic, Botox. Okay, as you can see, for me, when I learned that it's not just about removing wrinkles, but it's gonna be a medical treatment. Okay, it can be a
Yes.
medical treatment, not just for aesthetic enhancement, but a medical treatment. So if ever there's muscle that is too strong, we can weaken it with Botox. Okay, or we can stop it with Botox so that it can't be overworked. So it's gonna be relaxed more. So, Dr. Ivona, can you have a little bit more of conclusion of when it comes to Botox, or an advice to our audience on what Botox is, or if you want to correct any myth or myth-busting information that you can share with our audience?
So Botox is an art. Injecting Botox on a beautiful and artistic way, I would say, it's always, you have to be on a thin border in between balance of all 48 muscles on the face. Sometimes you do Botox on platysma, on the neck, trapezius Botox. As I said, also we can use Botox for calf reduction. So we can be very imaginative and very productive with Botox. Only thing we need to know is anatomy. We need to understand the medical device, how to mix it, and we can use it for all different muscles. We have to understand the pathology our patients have. For example, with Condillar Hyperplasia, or with temporomandibular disorder, or with Gummy Smile. Because if we have Gummy Smile class 1 or Gummy Smile class 3, we will not use the same pattern of injecting, because depends what muscles are in hyperaction.
Overworked, yeah.
Yeah, so that's all. Very, very simple and very beautiful treatment, which is treatment without downtime. You need 3 to 4 days that Botox works, kicks in. After that, you call the patients, recall the patient to see what happened on his face, re-enhance if you need, and that's all. So literally, I would say it needs maximum 15 minutes of your time. You don't need nurse. You don't need any special place, you know, like dentistry is so expensive at the end of the day. You need dental units, you need all these little tiny bottles. Here is very simple. You need one Botox. You don't need anything else. Physiological saline, you mix it, you need a patient, you inject, go. And that's it. So I think it's a very up-to-date technique, because our patients nowadays, at least in Europe, everyone is on Instagram. Everyone is so conscious about the way they look. So they can't anymore even go on graduation after medical school if they're not beautiful. So it's the society nowadays, and the patients are asking that from us.
The demand. patient.
This is a demand. So if you don't want to treat a patient, this patient is definitely going to get the treatment somewhere else. So it's at the end of the day up to you. If you want to understand that this is part of dentistry and it's part of beautifying smiles of our patients, because you can make the best veneers ever, but if you did not tackle nasolabial folds, or if you have lip corners that go too much down, then again, the smile is not perfect. So it's just up to us.
So you're right, Dr. Ivona, the investment is not that big, okay? The materials is not that expensive, no need for big equipments. The only investment that you will really need to invest is the knowledge.
Education!
Yes, education and knowledge how to use it. But I heard that you have a training for this kind of, we are blessed that you are giving your knowledge on regarding when it comes to Botox. But I heard that you have a training program for Botox application and fillers. Can you share
Yes.
any information about your training?
Well, I have the training program together with Dr. Jinga Lindas in DMD center, which is truly amazing because, you know, being a dentist, having all these problems when I was young, how to be trained, because at that time, nobody really wanted dentists in that medical field. But I couldn't get stopped because already at that time, I was thinking on the logical way. Who can treat better than me a gummy smile? Plus, I was periodontologist. Who could do that? Can one dermatologist treat better than me a gummy smile? It was ridiculous for me at that time already. But the trainings were not really available. First of all, because I started when the aesthetic medicine started itself. So nobody really at that time put the right standards. So now I'm so passionate about education. I educate since 2008 and I want to deliver with all my heart to all the youngsters out there, because I know how important it is, especially when you start to have a good support, to have a great foundation. Later on, you can do whatever you want. You don't need me anymore. But at the beginning, you need good education to feel more confident and to do all this in your practice.
So I can't imagine, did you have any backlash or bashers when it comes to, because of course, it's not common for dentists to apply Botox, but
no, it was a bit, you know, I had to struggle and I had to spy in plastic surgical offices to understand at the end how Botox works. Then we started to apply it on temporomandibular disorders. But then later on, it was all about being over connected with other practitioners who were using Botox at the same time. You know, it is nice on a way because you were on the forefront. So you were pioneering techniques. And we were at that time, I think, much more comprehensive and connected because we had to share whatever we did in order to progress.
We really are.
Being a dentist, it was not easy. It was never easy. But just, you know, you have to keep your mind straight and understand that this is a part of dentistry. And at the end of the day, as I said, it's more funny that a dermatologist or plastic surgeon is treating gummy smiles.
And because we are the masters on this field, and
definitely,
we know the anatomy so well that it's like the back of our hand already. So we know what is good for the patient. We know what is a good smile, a good length, every measurement of that we already know because we studied that in our undergraduate.
Let me explain, Dr. Arkhe, what is our course about. So we will have anatomy, very detailed anatomy of head and neck, because I know everyone passed anatomy, probably in the dental schools already, but revision is repetitius mater studiorum. As I always say, so revision of anatomy is crucial. So we will revise all this complex anatomy of 48 muscles, all of the facial fat pads, all of the ligament structures on the face, different veins and arteries which are passing by. And knowing our anatomy, as I said before, is crucial because we will know how difficult certain anatomical areas are for injecting. Then we have a second part, which is botulinum toxin part. So botulinum toxin type A part. It's not that we will talk about different brands, but here we are going to demystify botulinum toxin, explain what it is, what chemistry it is behind, explain the dilution, the way how to inject on a safe way botulinum toxin, what is the art of botulinum toxin, and how to treat medical conditions in the lower facial third, as well as how to enhance the lower, middle, and the upper facial third with botulinum toxin. Then, when we step into the world of dermal fillers, we will again invite all the dentists to understand the chemism of a dermal filler. So what it means cross-linked, non-cross-linked dermal filler, how many mg per ml a good hyaluronic acid dermal filler has to have. As you see, I don't talk about brands. We don't talk about brands, but we talk about pure education. So our idea, our wish, our passion is education. And we will always prepare you how to prevent the complication, how to manage the complication. And because, you know, in the world of facial aesthetics, everything is beautiful when you have a happy patient, but you must know also and be very, very confident in how to prevent and treat the complication, which is, I assure you, very, very easy, but just there are a few steps which you need to know. After this course, after this educational program, which is quite long, I think around 2 months, it needs to pass through all those, the quickest dentists and medical professionals need around 2 months to pass through all those different topics. After that, we have a hands-on, and after that, we can start to work more confidentially. In UK, a lot of dentists enroll into monitoring class, which means another 10 to 12 months, we have just clinical assignments and controlling them in clinics. So discussing the certain clinical cases prior to injecting, post-injecting, during injecting, which I think, again, it's a beautiful way to go.
Wow, so that's a very detailed course. So I think after that training, they will be more confident in treating their patients. So these are for the dentist who likes to know about Botox. Remember, we're the masters of this area. Thank you so much for Dr. Ivona for that wonderful course that you've opened. It opens up so many possibilities in the dentistry field. Thank you for including anatomy, because I know that anatomy is a very crucial thing. And at the same time, when you're teaching it on a different perspective, it's gonna be better, because when we studied anatomy when we're in the undergrad, we just know that it's just for this movement, just for this movement. But if you are in the perspective of using Botox and fillers on those muscles, it's gonna be more detailed and it's a different world. Okay, so really revisiting basics will be a lot helpful for us dentists. Okay, so
and it's very beautiful, because the anatomy normally, you know, medical professionals are stepping back from anatomy, but how we created anatomy is all the IT anatomy, so you can really understand it on a very simple way. And again, very important part on an anatomy course is clinical anatomy. So it's not just knowing the anatomy, but knowing how to apply that anatomy on the patient in front of you, knowing exactly where the muscles are passing, where is facial artery, where is exactly masseter, where to inject masseter to be safe. That's the key.
Yeah, because when we studied muscles, we don't have the skin. We're just using the model with just muscles, and we don't know where the muscle goes if there is a skin. So I think you'll give us good landmarks on where the muscles are. So thank you so much. Okay, so again, if you want to enroll for Dr. Ivona's course, the details will be down on our description. For the dentist, of course, you have to be a licensed dentist, but I think this is open also for other medical professionals, right?
Exactly.
Exactly.
Every medical professional is more than welcome.
Yes,
as we said at the beginning, nowadays knowing botulinum toxin, knowing basics of dermal fillers, important is for ophthalmologists, for dermatologists, for plastic surgeons, for GPs. So basically every branch, even gynecologists, because they need to know how to tox the wound after C-sections. So it's really, really super comprehensive, and every medical branch is more than welcome.
Okay, so this is open for physician and dentists only, okay? Not other courses, okay? Especially in the Philippines, on the PRC, it's only open for physicians and dentists, okay? So that is our topic for today, Botox. Thank you so much. We'll have our part 2 for our fillers, okay? So thank you so much for joining us. I'm again Dr. Arkhe De Leon, the dental architect, with Dr. Ivona, our guest. That's all. Thank you so much.
Thank you to listen to us. See you soon in Philippines.